Hi, it's Dr. Jenny and Dr. Daniel from Spinal Corrective Center in Amherst, New Hampshire. And we're doing a series called Beginner's Guide to Chiropractic. We thought we would talk about how often someone might get adjusted when they first start chiropractic care. That's something people wonder,
Yep.
I think probably the best answer is it depends on you and your chiropractor based on the health of your spine.
Yes.
And to some extent based on your current condition. So for example, we'll have people come in such severe back pain that they can't work, they're struggling to walk, and we'll literally see them every day just until they're back to work or they're functioning better or out of a severe crisis. So chiropractic is something that you could potentially have very, very often, and the chiropractor knows when it's appropriate to adjust or when not to adjust, but you could be checked even on a daily basis if you're in severe crisis.
Yeah, definitely. And it is a lot of it working with the patient and knowing that you can have control and set your care. Like, it is your decision, and we like to work with you and know what your expectations of us as your doctors are.
And of course tell you our best recommendation.
Absolutely.
But it's interesting sometimes based on your career and if you're traveling and where you live. We really try to make care, we set up to succeed.
Oh yeah,
right?
Yeah.
So another example is someone might come in with just a health concern, not in crisis, say maybe headaches, and they want to see what the health of their spine is like. And maybe we find a spine that doesn't have the perfect shape. Maybe the neck curve is straighter than it should be. So someone like that, especially who's new to chiropractic, I think it's really smart to do a short series of adjustments a little closer together. Like maybe 2 or 3 times a week for say a month to start and see where they're at. It's kind of like going to the gym. You know how you're like, I'm out of shape. It's time to focus on my health. You kind of know if you go once, or even if you go once a week, you might not really get momentum to create a change in how your body looks and feels. But when you have a short period of time, like if you hit the gym 3 times a week for a month, you'd start to see some changes, and then you can kind of scale back or change it based on if you're getting the goals that you want. So that's something we work with the patient.
Definitely. And then from there, if you like how the adjustments are working for you and you understand that it can help you with just general overall wellness and healthcare, then we do recommend that you keep coming in as needed, like every so often, so once a week, once every 2 weeks, to keep coming in and getting checked and making sure that you're staying healthy.
So a true wellness adjustment, we have many people who aren't necessarily in pain and they just want to keep their spine healthy, and our rates are set to try to make it as affordable as possible, and frankly people usually find that it's for the benefit they get, the cost and time it takes is well worth it. Probably the most common question I get is, well, what happens, can I go like once a month or just as needed, maybe a couple times a year? And my answer to that would be, well, any care is going to be beneficial, of course. If your goal though was to keep your spine as healthy as possible, the recommendation based on research is that you get adjusted minimum every 2 weeks. It's been shown that for most people, that will make sure that you don't develop arthritis, or if you have arthritis, it won't continue. So most of our wellness patients, we encourage that, and we create affordable plans so they can choose to do that if they want to. Be well, everybody.